Hello everyone, my name is Omar Solis and I'm going to be doing my presentation on is manual therapy based on neurodynamic techniques effective in the treatment of carpal tunnel syndrome. The purpose of this study was to evaluate the efficacy of neurodynamic techniques as a sole therapeutic agent in the conservative treatment of mild and moderate forms of carpal tunnel syndrome. Before going into the methods, carpal tunnel syndrome is when the transverse carpal ligament compresses on the median nerve that can cause pain, discomfort, numbness, or weakness. The study was a randomized controlled trial where 103 participants were separated into two groups, which lasted 10 weeks, and they would attend twice a week. The neurodynamic group would receive treatment that consisted of neurodynamic techniques that are directed at the median nerve and both sliding and tensioning techniques, and a control group that received no treatment. Measurements were taken before and after the 10-week intervention. The measurements that were taken were a nerve conduction study that assessed sensory and motor conduction velocity and motor latency, which can help diagnose several conditions, a 1 to 10 pain rating scale, the Boston Carpal Tunnel Questionnaire, which assesses symptom severity and physical capacity, and strength using the Jamar dynamometers. So for the interventions, as stated before, the neurodynamic techniques were directed at the median nerve. The anatomy of the median nerve is shown in the picture on the right. The median nerve originates from the medial and lateral cords of the brachial plexus and descends down the arm and enters the hand and branches out. These techniques consisted of 3 series of 60 repetitions and were separated by inter-series rest intervals of 15 seconds. All neurodynamic-based techniques use sliding and tensioning techniques and were performed in a supine position. These techniques, the neurodynamics sequence was as follows: arm abduction to 90 degrees, arm external rotation, wrist and finger extension, forearm supination, and elbow extension. Within each sequence, one directional proximal and distal sliding mobilization and one directional proximal and distal tensioning mobilization was applied to the participant. These 2 pictures on the right demonstrate sliding mobilization on the elbow and wrist joints and tensioning mobilization on the upper limb. So for the results, after the 10-week intervention, highlighted in green, sensory conduction velocity and motor latency showed statistically significant improvements. For the pain rating scale, highlighted in yellow, also showed statistically significant reductions in pain. Highlighted in blue, the Boston Carpal Tunnel Questionnaire for both symptom severity and functional status showed statistically significant improvements as well. For both cylindrical grip and pincer grip tests didn't show much improvements, which could be speculated that it could be due to the lack of a direct inclusion of a strengthening intervention. Conclusions and clinical implications of neurodynamics-based techniques on carpal tunnel syndrome. So first, some limitations that should be addressed in future research is the lack of a placebo group. This could potentially eliminate any placebo effects that may have occurred. 20 sessions makes therapy less economical, and findings are possibly due to an immediate effect of the previous intervention session. Some clinical implications of the study showed that manual therapy based on neurodynamic techniques had a positive effect on pain relief and subjective carpal tunnel syndrome symptoms. Neurodynamic techniques also improved hand functions, and neurodynamic techniques have a positive effect on nerve conduction.